Good evening. Thank you very much for joining this discussion today. I'm Dr. Gerard Musa, and today we'll be talking about cholera. Cholera in the past couple of months has made the news, and it's something that we've heard about on TV and on the radio, and has basically changed some of our lives in the past couple of months. So, in this media age, there's so much information out there. So, in this discussion, we're going to talk about the real information about cholera so that people get the actual facts about what exactly is going on. And we'll take a deep dive into what cholera is. We'll talk about how the symptoms, how to prevent it, and what you're supposed to do when you suspect that you have cholera. And also talk about vaccines. Where can you access them, and how long does the protection last? So to help us discuss cholera, we have a specialist guest with us. He's a specialist of infectious disease and the current head of the treatment center at the Heroes Stadium Cholera Treatment Center. Welcome, Dr. Sinkala.
Thank you, Dr. Musa, for having me here. It's great to be here to talk about cholera and to sensitize the people generally around it. So thank you for having me here.
Okay, great. Dr. Sinkala, maybe we can start from telling us a bit about who you are and what role are you currently playing in the management of cholera in the country at the moment.
Yeah, so like you mentioned, my name is Sinkalanel. I'm a registrar in infectious diseases, originally based at the Levi Mwanawasa University Teaching Hospital, the second biggest teaching hospital in the country. And then in the current cholera response, I've been tasked to head the biggest cholera treatment center in the country at the National Heroes Stadium. Our bed capacity here at the National Heroes Stadium currently is 1,200, but we do have the capacity to expand to even as much as 2,400. So that's the role that I'm playing. And I also help the cholera response with case management. I'm part of the case management pillar, and so I help around in that area as well.
Okay, that is great. Very great. It sounds like a lot of work. Sounds like a lot of
Yeah,
work.
it is. It does get busy sometimes. Yeah, but it has its days. It has its
How's it
days.
days, eh?
Yeah.
Uh-huh. So maybe you can tell us, many people are asking what exactly is cholera?
Cholera is an acute diarrheal disease that is transmitted through what we call the fecal-oral route. So you have to pick up the bacteria itself that causes the cholera, what we call the Vibrio cholerae, from the fecal matter, and then you have to eat it. That's what fecal-oral means. And then in most cases, you'll find that transmission is through drinking of contaminated water or eating of contaminated food. Those are the main modes of which people pick up the Vibrio. Then in terms of the incubation period or the time that it takes from when you pick up the Vibrio to when you develop the symptoms, the time period usually range between 2 hours to 48 hours. So that's on average, give or take 2 days. Then people develop symptoms. Now you'd ask yourself to say, what are these symptoms that people generally develop? So the most common thing is the watery diarrhea. So the diarrhea is quite profuse, comes out in huge volumes, and then it's effortless. So like you have no time to hold it in or to go to the bathroom. It's effortless, comes out in huge bouts. And then you find that you have a lot of these diarrhea bouts eventually turning into watery bouts. And the typical picture of what we call rice watery stool will come in when you've lost quite a good amounts of fluids. In addition to the watery diarrhea, there's also associated vomiting. So people usually start to vomit, and the vomiting is also quite profuse, and it's quite projectile. It comes out with a lot of force. Then, in addition to those two, the other common symptom that people develop is muscle cramps. So they will tend to have these abdominal cramps. Then you start feeling fatigue in your legs. You want to stretch your legs start cramping up. You want to stretch your hands start cramping up. Then outside those three main symptoms, Generally, they'll be feeling of weakness, and then people will feel their heart racing, like they get palpitations because they're getting weak and the body is trying to compensate. You start to feel lightheaded, you start to shake, you become lethargic, and then the longer the dehydration or the longer the diarrhea and the vomiting goes on, you eventually lose consciousness, and if not treated, you can eventually succumb to cholera and you can die. So generally, an acute watery diarrhea illness, incubation period 2 hours to 48 hours, then transmitted through the fecal oral route, eating of contaminated food or drinking of contaminated water will result in the signs and symptoms that I have mentioned. Key thing is the dehydration, losing of water through the diarrhea and the vomiting. That is what will tip into the other signs and symptoms that I've just run us through.
Mm-hmm. So this whole process happens very, very fast. You said even within 2 hours from contamination, I mean from contact with the vibro, you can already see symptoms.
Yes,
It happens
exactly.
very, very fast.
It happens very fast, such that people generally have no time to react the way we usually have time to react with other disease processes. With cholera, it's quite an acute disease, and it can kill quite acutely because of you pick it up in the morning, you start having your bouts of diarrhea. By evening, you'd have lost 6 to 8 liters of body fluids. So if we don't replace those, you can die in a very short period of time. Or if you present to a facility, you present to the facility severely dehydrated, and the teams will then have to work really aggressively to resuscitate you. So the acuteness is really the biggest thing with cholera, in that you really have a short time, a short window in which to react. You pick it up 2 hours later, you start having symptoms. If it delays, it's within 48 hours, symptoms kick in, and then you start losing fluids, and if not treated, you can succumb to the disease. Then in terms of the other thing that you can look at when you look at cholera, is you'd ask yourself to say, well, we've been seeing all these people getting cholera. Are they the only ones that are affected? When you look at the epidemiological picture of cholera, you find that actually 75% of the people that do get cholera will not present with signs and symptoms, but those people are still able to shed the bacteria in the environment. So what simply means is that 75% of the population have cholera, but they don't have the signs and symptoms, but they're still shedding it in the community. Hence why we emphasize on the prevention mechanisms, which we'll discuss as we go on. Then the 25% that present with the signs and symptoms are the ones that we see in our facilities. So even when you look at the numbers that we are having, like as Zambia, we've had over 14,000 cases of cholera since October cumulatively. And these are the ones that have actually presented to the facilities with moderate or severe illness. Those that have mild or asymptomatic, the 75%, are actually just out there in the community, still shedding the vibrio and still transmitting it. And then those are the ones that we usually worry about because they're not in our facility and we're not able to capture them and we're not able to sensitize them. And so when you look at some of the preventive aspects of cholera, when we talk about making sure that people have access to safe and clean water, they're chlorinating their water or boiling it, and then they are using proper toilets, or if they don't have proper toilets, they're using pit latrines, which they're able to cover, and then they're washing hands immediately after using the toilet. Not only washing hands, but washing hands with running water and using soap in addition to that. And then food, making sure the food is eaten warm and making sure that the food is covered if it's not being eaten, and not having the food being left open for flies to have access to it. So when we talk about those prevention measures, what we were looking to do is to try and break the chain of transmission, keeping in mind the 75% that are symptomatic that continue to shed. And so once we cut the chain of transmission using the preventive measures, and then we treat those that are presenting to our facilities, we're able to halt the outbreak and then make sure that we don't have many people that are infected. So that 75% is our biggest worry. And then when you look at the 25% that develop symptoms, we still have on that 25%, there'll be those that will come in very severe, which are the 5%. Now, those 5% are the ones that will come in severely dehydrated. They'll come in, most of them are coming in unconscious, and then a few of them are the ones that are being brought in already dead, unfortunately, what we're calling the community deaths. And in the current outbreak, if you look at the figures that were announced by the Ministry of Health yesterday, we noticed that cumulatively, we've had about 330 community deaths. That's been 330 people that have died in the community before presenting to the facility, which is quite a huge number, showing that people are delaying to come in to seek healthcare for different reasons, which we'll get to when we talk about some myths and stigma associated around cholera. And then if you look at in comparison to the people that actually reach the facility and die in the facility, the number is quite low, in the range of 200. Still a very high figure, but in comparison to the community deaths, it's quite low. And then in the last 2 weeks, as a country, in terms of our facility deaths, they've been very minimal. Like maybe you'd have 1 in 24 hours or 0 in most cases, as is happening in most of our cholera treatment centers, showing that the challenge is still with the community deaths, and so the community needs to get to the facility in good time so that we are able to treat them. And then if you look at in terms of how our epidemiological curve has been going, the number of cases that we've been having has been gradually decreasing because the government has put in intervention measures at community level as well as at facility level to try and catch the outbreak both in the community as well as when people come to the facility. As you can see, like we're in the Heroes Treatment Center, 1,200 bed capacity. So
you mentioned that there's a 75% of people who are still in the community and are just continuously shedding the Vibro, and that is where the big problem is.
Yes, so the asymptomatic ones, because they are not presenting with symptoms, so they will hardly come to the facilities. So the problem is that they're still able to shed the Vibrio in the community. So if you find that if they're not practicing proper hand hygiene, they're not using the correct toilets, then you find that they're able to transmit to other people or the susceptible population. And then you find that they'll continue to transmit, and then more people will continue to get symptoms. And then the outbreak then will be perpetuated. But if everyone that's out there that's asymptomatic practices proper hand hygiene, washes food, they use the correct toilets, then you find that we're able to halt the transmission. Because even if they are symptomatic, they only have a duration of carriage of like 5 to 7 days, after which then they stop the shedding as the body would have naturally cleared out the Vibrio itself. But then within that 7 days that they will be shedding, that's where our worry is. As then we don't know how many more people they would have transmitted to, or how much contamination they would have done to the environment. And those are the ones that when we preach prevention measures, we are worried about that.
It's impossible to know who is shedding without symptoms.
So in terms of possibility of knowing who's shedding without symptoms, right now it's a difficult venture to undertake, because then it would mean you need to collect 2 samples from everyone and then run some tests on them, which I think would be quite costly in comparison to just doing preventive measures for everyone who is asymptomatic. And that's the message that is being spread. It's better people practice proper preventive measures than us trying to swab everyone and see who's symptomatic and who's asymptomatic. And then when we look at to say those that are asymptomatic, if you find that they have the Vibrio, the only thing that you can do about it is, because they're asymptomatic, you're not going to admit them or isolate them. It's just to educate them on proper preventive measures and provide them with safe, clean water, provide them with clean toilets, so that you cut off that chain of transmission, and then you'll be good to go. Because even when you look at our treatment, those that are mild, we just give them ORS, we observe them for a couple of hours, usually 4 hours, and then if they are still mild or they become asymptomatic, we educate them on how to use chlorine, how to use ORS, and then what are the danger signs of cholera, and then we allow them to go home. And then we send the team to go to their home and just inspect that the sanitary facilities that they have are up to standard. And then once you are
Mhm.
satisfied with that, then you allow them to continue to live in the community with the assurance that they've been educated and they will not spread the infection.
Mm. So, just out of curiosity, maybe there might be someone out there wanting to ask if you suspect that you have cholera as a person, or you have, or there's someone in the family who is vomiting and is having the other symptoms, and given that in a very short period of time things can move from someone is okay to very bad diarrhea and even death, what are they supposed to do if you just
So
suspect that?
in the event that you suspect that you have cholera or someone close to you has cholera, the best thing that you can do is one, you need to make them quickly oral rehydration solution. So if you have the premixed pack, there's already a pack of ORS that's already reconstituted, and it comes in different sizes. So the most common one is the one that you're able to dilute to 1 liter of water. So you just open your pack, you get your 1 liter of clean water and safe water. So the safe water is either boiled and cooled or the chlorinated one and then allowed to sit for 30 minutes before use. Make your ORS and then start giving yourself or the suspected person, giving them ORS to drink, and then you start making your way to the healthcare facility. The reason why we want you to start ORS right from the home, even before you start off getting to the facility, is because we know that the cholera will cause you to get dehydrated very quickly. So by the time you'll be moving from your place, organizing transport to get to a facility, you would have lost a substantial amount of fluid. So would rather you start the ORS as you make your way to the facility. Now, if you don't have the already reconstituted ORS, how else can you make ORS at home? So ORS is easy to make
Mhm.
in the household setup. All you need is sugar, salt, and water. The same household sugar that we have, same household salt that we have is what you need. Now, in terms of the quantities, you need to get 6 teaspoons of the sugar and you level the teaspoon. What I mean by leveling is when you scoop your sugar, it forms that hill on top of the spoon. You clear off that heap. That action is called leveling. You get that 6 teaspoons of your sugar, you add to your bowl or your cup, whatever it is that you're using to constitute. Then you get 1 teaspoon of salt, you level it and then you half it. So you're getting half a teaspoon of salt. You add to the 6 of sugar. Then you get 1 liter of your safe and clean water and you add to that and you mix it. And then it is safe for consumption and it acts as ORS and it's equally effective. And then you can start giving it to your patient as you get to your nearest health facility. Then in terms of when you have made your ORS, there will always be questions to say, how do you store it? Or what's the duration that you can keep it
Yeah.
in case you want to premix it in advance? So if you have a fridge where you're able to refrigerate your ORS, you should keep it for not more than 24 hours. After 24 hours, you need to discard it and reconstitute a fresh one. Where you don't have a fridge, you can only keep it for a period of 12 hours, after which you need to discard it and reconstitute a fresh one for consumption. So that's what you need to do. Then, aside from administering the ORS, the other things that you need to do is to make sure that one, the other people that are surrounding the patient do not come in contact with the soiled clothing or the soiled linens. So make sure that you keep people away from those things. If you have gloves that you can use to touch the soiled linen, you better use the gloves. Put the linen in a plastic, and then it should be kept separate for disinfection with chlorinated water. Then two, if there's a bathroom that the person was using who's been suspected to have had cholera, you also need to make sure that, first of all, you stop people from using it before you have decontaminated it using chlorinated water, or the common household bleach is still able to do the job. Just make sure you read on the constituents and it's able to disinfect thoroughly. Then you disinfect the toilet, you disinfect the surfaces that the person possibly came in contact with, and then you can safely transport the patient to the facility. When you get to the facility, the vehicle that you have used to transport that suspected patient, you inform the authorities at the facility to say, we have a suspected patient whom we think has cholera. We would like you to come and help us to disinfect the vehicle. And the authorities are more than happy to, and they are willing to come in and disinfect or decontaminate the vehicle that you use for transportation. And then the authorities will also pay a visit to your house to actually see and help you to decontaminate any potential surfaces or any potential areas if you're not able to do the decontamination yourself. And then they'll teach you on other ways in which you can prevent yourself, and they'll go through the signs and symptoms in case any other person in that household has the signs and symptoms that we discussed earlier on, that we can then start to treat. And then they'll give you chlorine, and they'll give you the pre-constituted ORS, such that should anyone develop the symptoms later on, you already have the ORS and you already have the contact of someone at the facility that you can then quickly call, and then they can come in and help you to move the patient or the suspected cholera case. So that's what you can do in the case of a suspect.
Okay. And you mentioned that people can go to a health institution. Are there any specific institutions that are taking people with cholera at the moment, or can they just go to any institution?
So in terms of the cholera response, how it has been structured, the first line of defense is what we call our oral rehydration points. So now these oral rehydration points have been placed right in the communities, in the neighborhoods of the people. And the purpose of these oral rehydration points is to serve as a point where, in the case that someone does not have the premixed ORS in the household, or they are unable to make sugar, salt, and water in the household, they're easily able to walk into their community at this oral rehydration point and access this already made ORS, and they'll start the rehydration. And then also at this oral rehydration point, you'll find people that are already trained in the management of cholera. So they're able to help you to start the necessary resuscitation, and then they're able to facilitate the transportation of the suspected patient from that oral rehydration point to the facility. Now, if peradventure you are not aware of the oral rehydration point in your community, but you are aware of any health facility, all the health facilities have been trained in managing cholera cases. So once you get to your nearest health facility, the health facility will receive you. They will institute the necessary resuscitative measures if need be. And then from there, they will then transfer you to the designated cholera treatment centers. So all the health facilities are able to receive patients. Once they've received you, they resuscitate, they do the necessary measures, and they assess to say, yes, truly, this is cholera, or no, it's not. And then they'll be able to transfer you either to a facility that is managing cholera, like Heroes, or they'll transfer you to another facility that will manage in case it's bloody diarrhea or any other diarrhea. Because you may be aware, it's not just cholera that can cause diarrhea. There are other disease entities that can cause diarrhea. So the point of you getting to the facility is that they should be able to assess and then institute the necessary treatment measures, and then refer you to the cholera treatment center for continued care. So you can get treatment at any facility. There'll be no discrimination. There'll be no stigmatization. And then from there, they will refer you to the necessary cholera treatment center for isolation and continued care.
Okay. That sounds good. And for the taxi driver out there who is afraid of picking up someone who has cholera, how easy is it for them to get the car decontaminated?
So actually, it's very easy, because what we've done is the infection prevention and control aspect has been strengthened such that any vehicle that brings patients, be it an ambulance, be it a private vehicle, it's mandatory, it has to be decontaminated. So there's very little room to say if the taxi driver picks up a patient and brings to the facility, they will not be decontaminated. No, you will definitely be decontaminated. And for bringing that patient, when you come to the facility, we'll also offer you education on how you can prevent yourself from getting cholera, and we'll also give you chlorine to use as well when you get back to your household, and we'll teach you on how to recognize the danger signs, so that peradventure, because people would generally not tell you that I have cholera, so I want to get to the facility. They'll just tell you, let me get in a taxi, I go to the facility, because there's a lot of discrimination usually that comes in. So when they get into your taxi, then you notice that, this one is having danger signs, this one is vomiting, or this one is having diarrhea, then we'll tell you to quickly rush them to the nearest facility. Then once you get there, we'll help you to decontaminate your car. We'll help you to clean your car and make sure that it is safe for you to go back into your business and continue with your livelihood. So the taxi drivers, the bus drivers should not be afraid, and they should not fear that, no, if I carry someone, then that will be the end of my business. Now, when you come to the facilities, we'll decontaminate your car, and you actually would have saved your life. So they shouldn't be afraid at all. That decontamination will be done, and it is being done.
Okay, excellent. And maybe just another question. After having treated so many patients, what are some of the myths that you have heard about prevention that you think really needs to be clarified to avoid stigma and people being shunned away from treatment and care?
So in terms of the biggest myth that we've heard is actually from our male patients, because majority of the patients that we're having are males. So you find like for every one female that you admit, you have 3 males admitted. That's how our ratios are. And the number one myth that has been going around with the cholera response, not only this cholera response, but even in past outbreaks, is that cachaço, our locally brewed alcohol, actually does cure cholera. And so you find that most of the males, when they start having the signs and symptoms, they'll go to drink cachaço instead of presenting to the facility. And that has resulted in quite a number of people actually dying in the community, or when they come to the facility, coming in very bad shape, because instead of seeking healthcare or drinking the ORS, they want to drink cachaço. And you know how alcohol is. Alcohol in itself, it makes you dehydrated, because then they start to pass a lot of urine, then coupled with the diarrhea, then now it's a total mess. So that's one of the myths that has been going around. Then the other myth that has been going around is in terms of the transmission. Actually, some communities believe that cholera is transmitted through bad air, like because when there's a bad scent that comes in, then people breathe in that bad air, then that's how you get cholera. That's another myth that has been going around. Then others, of course, there's myths around vaccines, to say no, it's the same vaccines that they're giving. Those are the ones that are spreading the cholera. Those are the main myths that have been going around. Then in terms of the stigma is just generally around the disease itself, because cholera in itself has, from time immemorial, has been associated with poverty, and it has been associated with generally being dirty. So people are scared to say, if they say, no, such and such a person has cholera, then everybody will think, no, he's a dirty person, he ate feces, based on the fecal oral route of transmission. So those kind of make people shun away from opening up and seeking care until it's too late. Those are some of the myths and stigma that is generally going around.
Okay. I didn't know people actually thought cachaço cured cholera. It's a very, very interesting myth. Yeah, because the alcohol will make you dehydrated, like you said. It really makes things worse. I should think so.
Yeah, exactly, and that's what's been going around. So those are some of the messages that the risk communication and community engagement team has been trying to break down, telling people to say, no, the cachaço is not helping the situation. And then the other thing that we've been having is that, because people think the cachaço is helping them, so they get heavy on drinking the cachaço as a preventive measure as well as a curative measure. And then when they come in here, now you have to treat the alcohol intoxication as well as the cholera. So it then kinds of complicates your management in a certain way. And then because the alcoholics, then you have to deal with the withdrawal later on.
I'm very glad that you touched on vaccines as well. How do these vaccines work, and should people actually take these vaccines?
So in terms of how the vaccines work, the cholera vaccine, the one which is currently being administered in the country, is an oral vaccine. So it's no needle pricks or anything. It's an oral vaccine. You drop it in your mouth, you swallow it, and that's it. It's the type of vaccine that we have. If you take one dose, it covers you. It gives you protection for 6 months. Then if you take 2 doses, that's 2 weeks apart, It gives you protection for 3 years on average, ranging from 3 to 5 years. In terms of the safety profile, this is a vaccine which we have used in country since 2016, 2017, thereabout. And it has shown to be quite effective with very few side effects, if any, that have been reported. In terms of where people can access it, there's been different modalities of vaccination. One, it's been like at the facility. So the healthcare facilities have had vaccination points set up. So you can just walk into the healthcare facility and you'll be able to access the vaccine. And then two has been the public outreach. So in the public places, in the marketplaces, in the bus stops, the team that's doing the vaccination campaign has set up points in these places. So as people get to the market, as people transition into the bus stops, they're able to quickly go in and access the vaccine. And then three, it's the door-to-door approach. So the teams that have been doing the vaccination have been actually going into these communities where we're having these huge numbers and knocking on each and every door and administering the vaccine to the household members that they're finding. Then the next question that people have been asking is, who is eligible to get the vaccine? Can anyone get the vaccine? Are there any contraindications? So anyone that is aged 1 year and above can get the vaccine. In terms of contraindications, the only contraindication is if you've taken the vaccine before and you are allergic to it. That's the only contraindication. Beyond that, pregnant women, it has been shown to be safe. The elderly, it has been shown to be safe. If you have any comorbid condition, you're hypertensive, you're diabetic, you have HIV, you have sickle cell, you name any comorbid condition, the vaccine is safe to take. There have been no contraindications that have been shown. Side effects that have been reported in less than 1% of the people that have received the vaccine. It's only a few who say, oh no, after I took the vaccine, I developed a bit of abdominal cramps. Others will say, no, I had one bout of diarrhea. Beyond that, no, we've not had anyone come in with an anaphylactic reaction, like a severe allergic reaction. We haven't had anyone come in. And in this current vaccination drive that has been going on, I think if I remember the figures correctly, more than 1.7 million people, 1.7 million people have been vaccinated. And no allergic reactions have been reported from the drive that's been going on. So the vaccine works, 6 months for 1 dose, 3 years for 2 doses. And the vaccine is just one part of the whole cholera response, as well as we're doing the case management on our end in the facilities, and then the water is being provided. Then on the other hand, there's the vaccination that's going on. Side effects, like I've said, very few side effects. So people shouldn't be scared to say, no, if I get vaccinated, this will happen to me. There's no such things. It's very safe. No needle pricks, you take it orally. Because others will say, no, I'm scared of needles. I don't want to be pricked. So there's no needle pricks or anything of that nature. Yeah.
So which means in addition to the other preventive measures that you had mentioned, making sure your water is boiled and chlorinated, and making sure your food is nice, clean, safe, away from flies, you would actually advise everyone to get vaccinated.
Yes. We would advise as many people as possible to get vaccinated, because in as much as we're putting in these other preventive measures, there's always a possibility that someone may lapse, and then you want the vaccine to offer them that added protection. So yes, we encourage as many people as possible to visit their nearest health facility and where the vaccination campaign is going on, and get vaccinated.
Okay, excellent. And for that company out there, or that individual out there who is feeling generous and would want to add on their effort in terms of donation to the fight against cholera, how would they go about doing that? Is there a specific point they can reach out to?
Yes. So in terms of the donations, either from individuals or from companies and people that want to help with the cholera response, they can reach out to the Ministry of Health at the headquarters at Ndeke House, or they can reach out to the Disaster Management and Mitigation Unit under the office of the Vice President, and then they can go in declare what they want to donate, and then it will be facilitated. The process is quite smooth and seamless, in that we've had people calling in the morning to say, hey, I have these items that I would like to donate to the response. Where can I go? As soon as they get into the ministry, they declare what they want to donate, because, as people are donating, we also have to account for what they're donating, and also to check and to ensure that what people are donating is actually of quality and of good standard, and it's not going to pose a hazard to the people that are going to be using it. So that's why it has to go through that central line of command. And then once the ministry has cleared them, or DMMU has cleared them, then those things are brought, and the minister, I think you've seen on various platforms, she's been on hand to receive a lot of donations from different people, ranging from just individuals all the way to multinational companies and international organizations donating. And then once those things are donated, they are taken in. So in terms of what people have been donating to help with the response, and what if people want to donate, things that I think they can help, amongst other things, I think the biggest thing has been chlorine, both in liquid form and in granular form, to help us making our water safe. And then 2 has been in commodities generally to use in the facilities. This has ranged from IV fluids to food for the patients, though I think this one for food for the facilities, the government has been supplementing this quite well. Then in terms of, but people can still donate, not to say that they shouldn't. People can still go ahead and donate, as the response is still ongoing. And then also in terms of gumboots, because there's a rapid use of gumboots, not only in the facilities, but also in the communities, and other personal protective equipment that they can use. And then also people can donate themselves, actually, in terms of their time. You can donate yourself to say, well, I'm a doctor, I would like to donate a few man hours into the treatment center, and that is very much welcome. If you're not a health practitioner, you can donate yourself as a general worker, and you can go and help out in the community to clean up the marketplaces, to clean up the drainages, or you can come in the facility and help to move a few items around. Then other commodities that people are donating is safe water in itself. We've seen people donate tanks, these 10,000, 5,000 liter water tanks to install in our communities that lack access to safe and clean water. So generally a wide range of things. And if you're not sure what exactly to donate or where to get these commodities, you can actually donate cash to the ministry or to DMMU, and then they'll be able to convert that cash into different commodities that will be needed at that particular point in time. So people can help in different ways. And also the other way that people can help is through platforms like this, where you're able to host different professionals to talk about different aspects of the cholera response, by sensitizing the people out there about what cholera is, the dangers, the signs and symptoms, and how they can prevent themselves and keep themselves safe, like what we've actually been doing for the last couple of minutes. And so this is another way in which people can actually give and help the response. We've seen different TV and radio companies come on board to talk about the cholera response, and in that way they're sensitizing the people and making the people aware. And so when you reached out and you invited, I was very happy, and I was like, no, we need more of such. And that's why I even said, no, we need to dedicate time, and we follow through with this program and make sure that we sensitize the people and do as much as we can. And so I think you and your team, you have donated in a way to the response, and so a lot of other people can follow through. And so kudos to you and the team, Dr. Musa. Very big donation that you have done.
Thank you very much. I like what you said, because out there people are thinking donations is money and very, very big material. Time, like you put it, time is also a very good way of donation, whether it's specialized service or non-specialized service, like general working. That is a good, it's very good advice for someone out there who's asking themselves what they can do to help in the cholera response. That is very good.
Yeah, exactly. So maybe generally people think donations have to be huge forms of money, or you have to buy huge quantities of commodities, not realizing that even just their time itself goes a long way in helping. Right now, we've seen there's a community response that's going on. You can join that community response. And also in your own community, you don't have to wait for the team to come into your community to help with the cleanup. You can dedicate your time just within your own community to sensitize the people, or to start up a cleanup campaign just within your own community. And that goes a long way in the response, in the fight against cholera.
Oh, well, thank you very much, Dr. Kala, for those words. Maybe one last question that I would like to clarify. What advice would you give to people who are running restaurants? Because it might be a bit difficult for them to screen everyone who's coming, and people who are working there and people who are coming to eat there. What advice would you give for those people who are running restaurants, especially the smaller restaurants in those high risk areas?
So in terms of the restaurant owners, the advice is twofold. So one, it's on the restaurant itself. They need to make sure that they have, first of all, running water. This running water doesn't necessarily have to be piped water. They can have nice, clean, safe storage tanks that they're able to use and make sure that the water is running. Then two, they need to make sure that the water that they're using is safe and clean, either boiled and cooled, or they're able to chlorinate it and then use it. Then three, the people that they have employed to be cooking for them, they need to make sure that they teach them the proper infection prevention and control measures. That is proper hand washing with running water and soap, making sure that before they cook the food, they thoroughly wash it, and then they start cooking it. And then before they serve it, they need to make sure that it's served hot and served in good time to the clients that would come through. And then if they're not serving it immediately, make sure that it's covered. And then in their work premise, they need to make sure that they have proper sanitary facilities and they don't have garbage heaps accumulating in the area that they're working in. Then they need to make sure that they don't have flies flying around or hovering around. So they need to make sure that their place of work is generally clean. Then for the people that are handling the food, for all restaurants, if I remember the laws correctly, all people that handle food are supposed to be certified food handlers. So they just need to make sure that the people that are working are certified food handlers. And this can be done at any local hospital. They can quickly take in their staff for testing to be certified food handlers, and then they can be certified if they qualify, and they'll be able to serve. Then now, on the advice of their clients that are coming in, the restaurant owners need to ensure that their hand washing points are easily visible and readily available right at their entrance, so that as their clients come in, before they even enter or touch anything in the restaurant, they wash their hands with running water and soap, and then they'll be allowed to enter that premise. And then after they finish eating their meal, they should be also wash their hands with running water and soap. And then if the client needs to use the bathroom, they need to make sure that in that bathroom there's running water to wash hands immediately after using the bathroom with available soap. And then the toilet should be flushable, or there should be water readily available to pour in that toilet, and disinfectant readily available to disinfect, so that they break that chain of transmission. And then we understand that people have to eat, and restaurants are a business. So in order not to have these restaurants shut down, it's easier if they quickly put in place these measures: hand washing points, running water. They ensure that they have a toilet, their facilities are clean, swept regularly, no garbage is piling up. They should have safe places to dispose their garbage. They get proper bin liners, so that if the garbage accumulates, they're able to tie it on top, so that there's no flies getting on the garbage and then coming to their food. And then as their clients come in, they make sure they have a hand washing point, emphasize that their clients wash their hands. And then also, just to avoid, when people have eaten, they shouldn't just stick around hovering. They can usher them out quickly, so that they prepare for the next patients and they clean the place before the next people come to eat it. So that's the advice that we can give. And then also, the restaurant owners can serve as good ambassadors for the fight against cholera. They can easily reach out to the authorities in their areas, get branded material in the fight against cholera, what we call information and education material. They can stick posters in their restaurants, so that even as people are eating, they're able to read and see that we have an outbreak, and people should take in the necessary prevention and control measures. And also they should be able to talk to their clients as they come in, just to see if anyone has signs and symptoms, and refer them to the nearest health facility if
They should
need
be
be.
checking histories, eh? They should be checking histories.
Yes. So that's the advice that we can give generally to our restaurant owners. Otherwise, restaurants are a vital part of our community, and we need them for the communities to continue to flourish. But we also need them because we understand that the restaurants are also a potential source of spread. If that one cook is not practicing proper hand hygiene, we have a lot of traffic coming through. They mean in all those, there's a potential chance of contaminating all those people. And if that one person comes through, didn't wash their hands properly, they also have a chance of contaminating the restaurant. And then the more people that come through, we continue to spread. So we can break the chain of transmission in our restaurants, as well as use them to be our good ambassadors in spreading the information, the right and the correct information on cholera in the communities.
Okay, that's great. I think the last question that I'm sure everyone out there is very, very interested in is, are we winning, Dr. Sinkana?
So that question, I think it's a very good question, and everybody has been asking to say, well, are we winning this fight? Because we keep on seeing the numbers are going 10,000, 11,000, and the number seems to continue to increase. But if you look at the epidemiological curve that our colleagues from the surveillance team have been showing us, and this information, it's readily available on social media, on the Zambia National Public Health Institute page and on the ministry's page. The number of cases have actually been reducing. We hit our peak number of cases in the last week of December during the festive period and in the first week of January. But then beyond that, the curve has been showing a downward trend. So showing that the interventions that probably are being put in the community are actually working. And this we have also seen by the number of admissions that we are receiving on our end. The number of admissions has been gradually reducing. In the earlier weeks, you would have like 800, 900 to 1,000 patients in admission cumulatively as a country. But that number has been gradually decreasing. We're now in the range of 500, 300, in that range, showing that the curve is going downwards. And that's a sign that we are winning the fight. But the fight is not won now. The fight will be won when it's declared that we have no cases. Because the fact that we keep having cases every day still shows that what we're doing, yes, is working, but we can do more to ensure that we come to a day when we will say, it is finished. There's no more cholera cases. And that fight will only be won, not for this current outbreak when the numbers hit zero, but that fight will be won when we as a country or as a world say we have eliminated cholera as a disease in its own, just like we have done for other diseases, because we can win this outbreak. Come next rainy season, we have another outbreak, and then work done would have been zero, because then we'll be back where we are. And as a country, we've had cholera. Our first recorded outbreak was in 1977, and beyond 1977, we've had 32 recorded outbreaks, and this one makes it number 33. And so we see that, why do we keep having these cases? So for us to say we're winning the fight against cholera will be when we no longer have outbreaks. And then we'll safely say, yes, we won the fight. But for now, this current battle that we're fighting, the numbers are showing that, yes, we are winning. But for the war against cholera, it will be next season. If we don't have an outbreak, then we will say, yes, we won the war against cholera.
Okay. I'm sure that with more sensitization and with people following the instructions that have been laid out by the Ministry of Health, we'll win the war. Eventually, we'll win the war.
Eventually, we have to win the war. We will win the war. And I think part of what the ministry has been preaching from the updates that the ministers and the other senior technocrats have been making, the cholera response is not a baby for the Ministry of Health. So there's a multi-sector approach that has been taken. The Ministry of Local Government is there, Ministry of Community Development is there, Ministry of Water is there, showing that cholera is not only a health problem, it has all these other associated factors that determine the outbreak. If people don't have safe water, you have your outbreaks. If people don't have proper infrastructure, you have the outbreaks. So all these line ministries have been working together to ensure that these outbreaks is controlled, and then we prevent other future outbreaks. So there's been that multi-sectoral response that has been going on, and that we've been seeing going on, showing that if we continue on the same trajectory, eventually we can win this war, and we will win this war against cholera.
Okay. Well, thank you very much, Dr. Sinkala, for joining us in today's discussion. I'm sure everyone watching out there has really learned a lot. And I have personally learned a lot. And we just want to hope that the people out there will take on the preventive measures that have been discussed in this video and that have been preached by the ministry and the other ministries and other people who are taking part in the cholera response. So once more, Sinkala, thank you very much for joining us.
Thank you very much for having me, Dr. Musa. It's been my pleasure discussing cholera with you, and I really appreciate you reaching out, and I hope this message goes out to as many people as possible so that we can continue to win this fight against cholera as we look to eliminate cholera. Thank you very much to you and your team.
Okay. No, thank you very much.